I'm Jenny Watson, born and raised in Pleasant Grove.
Josh Watson. I grew up in Richmond, Virginia. I've been in Utah for about 10 years now.
Our high-risk doctor set us up to see one of the primary children's hospital cardiologists.
Since I saw you last, any medical changes?
Nope. The first time we met with Dr. Sue, he did a fetal ultrasound to verify and make sure that there was an issue.
Okay. Right now the coronary arteries are coming off right here. And after they get switched, it needs to come off there to get the oxygenated blood. And this is where we do the arterial switch procedure, which is we're just switching these two great arteries.
And they just sit you down and walk you through every scenario, what might happen.
This should go as planned from a delivery standpoint.
It was really good the way they just walked you through every step, every process, every procedure that they might need to go into.
Set up where there are rooms back here, patient rooms back here, and there's also additional patient rooms. My name is Kim. I'm the fetal nurse coordinator. I meet with families who are prenatally diagnosed with congenital heart defects. First comes over is kind of what you'll see over here. It's a lot of information when they come here on their first visit. You get bombarded with this diagnosis about your baby, and then as soon as you get in the car and drive off, all these questions flood. So they usually come back with a couple of those also, and just as the fluid decreases.
As we were walking through the hospital, you could see the children that were hooked up to all the monitors and all of the cords and all of the machines and things, and it just kind of prepared you.
A ventilator helping the baby breathe after surgery. So I hope that they feel that I can help them when they have the questions.
In the interim, let Kim know and she'll be able to get,
Okay.
all of us. All right.
Awesome, thank you, appreciate it.
Yeah, absolutely.
We woke up early and we went down, and I just held him, just having him go. You can't be prepared for something like that. It's amazing how connected you get.
You never want to see your own child go through something like that. And as a dad, if I could have laid there for him in that operating room, I would have. But they had walked us through everything, and we knew they were good at what they do, and that gave us peace of mind.
One thing that we work really hard to achieve is that our patients feel comfortable and they have an expectation and they know what's going to happen when they have a surgery or they make a visit to our center. It's a time where they're very vulnerable, they're trusting us, they're putting the care of their child in our hands. So I think any efforts that we can make to help them know what's going to happen, make them aware of the facilities that we have, and really know what to expect. We've got wonderful staff here that are caring and compassionate. I think go the extra mile to make families feel at home and welcome. My name's Jason Argyle. I'm the Administrative Director with the Heart Center here at Primary Children's Hospital. One of the things that I'm really proud of here with the Heart Center is our ranking that we're one of the top 10 programs in the country.
We perform approximately 13,000 echocardiograms per year here, over 700 fetal echocardiograms per year. We care for patients who have come from 42 different states.
There's a lot of coordination that goes into heart surgery. In addition to the heart surgeon, we have 2 scrub techs for every case that provide us with instruments, so our focus can remain on the operative field.
It's nice to develop that kind of relationship with people where they kind of know what the next moves are.
We have a team of over 40 physicians in cardiology, cardiothoracic surgery, pediatric anesthesia, and cardiac intensive care.
We are all board certified in critical care. In addition, have training and expertise and experience in critical heart disease.
We see over 13,000 patients in our outpatient clinics per year.
We're one of the busiest cath labs in the country. Last year we did over 800 procedures. Cath lab is an area where we're able to treat patients. Catheter is advanced through the venous system into the heart, and we're able to take pictures and see what's going on, insert a balloon or put a stent or another medical device in, depending on the condition of the patient.
We focus not only on the outcomes for our patients, but on the entire family.
It was amazing, the relief when we got back into the room, just to see him and that he was okay. I didn't realize how much I'd been holding in.
I feel like I can relate to those parents. I know what it's like to have your child whisked off into the operating room and not know, and to worry, put all that you trust into these surgeons that your baby will come back to you. My first child was born at a hospital here in Salt Lake area, and when he was born blue and not breathing very well. And of course it was early in the morning at 4 a.m. and nobody knew what was wrong with him. And so they started some medications to try and help stabilize him, and they flew him here to Primary Children's Hospital. They took him to surgery at 12 hours old. He was in there most of the night, and after he was done with the surgery, he went to the ICU. I remember the nurses that took care of my child. I remember the doctors that were here that day, and I remember their caring so much and them just being so kind. So now he's 11 years old and doing great. He comes in every year to get an echocardiogram to just look at his heart to make sure everything is growing right with him. And I just feel very fortunate that we have this facility here that can provide such excellent care to kids like him.
You know, I'm a people person. I love my relationship with my kids and their families, so it's really rewarding for me just to be part of their lives.
When you see a child who has a complicated defect who does well, and a family who gets to take their child home, I think certainly that makes it worth the effort.
And so people are doing this job because they love it and because they want to make a difference and improve outcomes of kids with heart disease.
Fortunately, our team has an incredible number of very talented physicians, nurses, and staff members who together achieve amazing outcomes.
Easy on the soul, she's so easy on the soul.
We're finally past it all. It seems like it was a long time ago, but
Primary Children's Hospital is there for the kids, but it would be safe to say that they could change their name to Primary Family Hospital because they really took care of all of us.
I think it's worth it 100% to have the best taking care of your child, because that's all you want. You want the very best for your child.